Good morning, everybody. Thank you for joining us. This is Heather Thomas with the Joint Information Center for Snohomish County's response to COVID-19. I'm going to take just a moment to click buttons to make sure that all the media have permission to record. You will have permission to record this briefing, and we will also be posting a recording to the Health District's YouTube channel later this morning. So give me just a moment. Okay, I believe I've given everybody permission to record, but if you have any issues, please send a message through the chat box to Joint Information Center and I will get that fixed. We are joined this morning by Snohomish County Executive Dave Summers, Snohomish Health District Administrative Officer Shawn Frederick, and Debbie Warfield and Cathi Lee here to speak with you about the Candlelight Vigil happening next Tuesday for Overdose Awareness Day. Each of our speakers will share some comments, and after they've all spoken, we'll take questions using the chat feature. Please be sure to submit your questions to everyone so that all of our speakers can see. Thank you again for joining us, and with that, I'll hand it off to Executive Summers.
Thank you, Heather. I'd like to start this morning with just a few comments about Afghanistan. I think as a nation, we've all watched with very deep emotion as events have unfolded in Afghanistan over the last couple of weeks. So I want to let you know I stand in solidarity with all Afghans who have worked alongside the United States over the last 20 years, particularly those who put their lives on the line by working with our brave men and women serving in the armed forces, and stand in solidarity with their families also, who are also in danger. I want to also offer my support to those many members of our community who served in Afghanistan and now may have very mixed emotions about the events we are all seeing. We knew sacrifices have been made by many, including those family members left behind, and we will do all we can to support them. So Snohomish County really has a long history of being a community that welcomes and supports refugees who resettle here, not only in pursuit of a better life for themselves and their families, but also as an opportunity to express their freedoms and enjoy their freedom. Snohomish County has already begun to receive new community members here into the county, and we expect to welcome approximately 1,200 people in the coming months. Many of the Afghan refugees entering our community are coming to America with only the clothes on their backs and on very short notice. After experiencing very significant trauma, the last thing individuals and families need to worry about is having a safe place to sleep or where their next meal is coming from. So we will be taking care of those needs. Resettling in a new country is a complex and difficult process that often takes years, and we will be there to support them. There are many needs that as a nation, state, and community, we have a moral obligation to help meet, including basics such as housing, food, access to healthcare, mental health support, assistance finding employment, enrolling children in school. So it's a long pathway to being resettled here. We really, I believe, have a moral obligation to ensure that our new neighbors have access to many of these necessities, including safe shelter, food, clothing, and COVID-19 vaccines, so that it's the best possible start for their new life in the United States. So they helped our soldiers in Afghanistan, and now it's our turn to help them. I've directed my staff to work closely with local organizations, including Refugee and Immigrant Services Northwest, to assist in providing these much needed resources. And I'm having community members reach out to me directly offering assistance. So I'm very grateful for that. If you'd like to support these efforts, I recommend reaching out to local relief organizations to offer your time and/or financial support. On the COVID-19 front, I was encouraged to see that the Pfizer vaccine has now been authorized for regular use. If anyone was waiting for this decision, I'd encourage them to get vaccinated now before booster shots begin to increase in demand. And finally, last week I proposed, and the Snohomish County Council has approved, giving leave to all our county employees for getting the COVID-19 vaccine. This applies to everyone that's a county employee, and gives some of our hourly workers in particular the opportunity to get their vaccines. We want to try every incentive we have available before we impose a mandate. Particularly in light of FDA's full approval of Pfizer's vaccine, I believe now is really the perfect time to keep yourself and your community healthier by getting vaccinated. So I'll be moving forward with that. And with that, I'll hand it off to Shawn Frederick of the Snohomish County Health District. Shawn?
Thanks, Executive Summers, and good morning, everyone. I believe we'll have a few slides coming up here in the morning, in a minute. There we go. Dr. Spitters is off today, but he put together a few data slides that we'd like to share. First is going to be a look at the total number of confirmed cases. For those monitoring our numbers closely, you may recall that we reported nearly 1,700 new cases for the week ending August 14th. Due to some reporting lags from clinics and laboratories, that revised number exceeded 2,000 cases and was the second highest number of confirmed cases since the pandemic began. Our preliminary number for the most recent week ending Saturday, August 21st is currently at 1,710 cases, but we expect this may increase slightly as more labs come in. That brings us to our 2-week rolling case rate, which is up to 442 cases per 100,000 residents. Again, the second highest case rate over the last 18 months. Next slide. Hospitalization numbers continue to increase as well. As of this morning, there were 85 residents in the hospital with COVID-19, and 11 of them requiring ventilators to breathe. The hospitals continue to see a surge due to COVID and non-COVID patients, as well as shortages in healthcare workers. We need everyone's help de-escalating the current situation by masking up and getting vaccinated if eligible. On top of this, the healthcare system continues to work with the Northwest Regional Healthcare Network and other coordinated systems in place to address needs. The rapid increase in cases over the last 6 to 8 weeks is a result of a combination of factors. One of them is the Delta strain. The most recent variant report from the Washington State Department of Health shows that Delta is now really the only virus in town. The Delta strain was accounting for more than 95% of the cases sampled through July. And the Delta strain is causing people to get sick quicker, making it easier to spread and infect more people than previous strains. Another big factor in our cases is the number of people in Snohomish County who are not yet vaccinated. This table shows that more than 10,000 people received the vaccine last week. That brings us to nearly 500,000 people who are fully or partially vaccinated. For the 44,000 who have not completed the second dose in their series, please do so as soon as you're eligible to get the final dose. But we still have 209,000 residents in our county that are eligible but haven't been vaccinated, and 124,000 kids 11 and under who are still waiting to be eligible. Plain and simple, we need to get more people vaccinated in our community to help protect those who can't get vaccinated. With Pfizer now receiving FDA approval for those 16 and up, we're hoping those who had been waiting for that approval will get vaccinated as soon as possible, because the Delta strain has unfortunately become very efficient at moving through communities at lightning speed. The vaccines and masks can help us add a protective barrier. In a report we released on Friday, data through July 31st showed that roughly 80% of the reported cases were unvaccinated. The blue line here shows the rate of cases per 100,000 of reported COVID cases in fully vaccinated, compared to the green line, which is the rate of cases per 100,000 of reported COVID cases in unvaccinated residents. Lastly, Dr. Spitters and our EPI team looked at the crude estimated vaccine efficacy. This is the line in yellow, which is the rate in unvaccinated minus the rate in vaccinated divided by the rate of unvaccinated. And here's a similar chart looking at hospitalization rates. While this crude estimated vaccine efficacy has moved from stellar down to very good, it is still very good. Dr. Spitters offered a few reasons why we may be seeing this slight decline in vaccine protection. First and foremost is the Delta variant. This has really changed the game and wasn't around to be tested on the vaccine when the vaccines were being developed. This is similar to the flu vaccine, where different strains come along and the efficacy of the vaccine ebbs and flows a little. The other factor to look at it at this time, since vaccination or waning immunity, we'll come back to that in a minute. Lastly, vaccinated people are more likely to be older, and older folks are at higher risk for serious disease. All of this to say, these vaccines are working. They're saving lives and they're reducing the strain on our hospital system. In a DOH transmission report, they stated, if the entire population were to experience the rates of hospitalizations currently seen in the unvaccinated, the hospital system would be completely overwhelmed. Even 75% efficacy is still very good, and the personal benefit from getting vaccinated still strongly outweighs low risk of vaccination. As a reminder, we have to think vaccination and masking, not vaccination or masking. The last update to share is around boosters. The additional dose for moderately to severely immunosuppressed individuals is not a booster. It's an additional dose in the primary series to help increase response in this population with a very weak immune system who are less likely to respond to a two-dose primary series. As we all heard last week, it is likely that a third booster for others will be recommended at the 8th month mark. We're awaiting further details, which are dependent on the scope of the FDA's authorization and CDC's recommendation for use after their review of the evidence. The ACIP is meeting next week, and we anticipate more details to emerge around that time. So in closing, wear a mask indoors, wear it as crowded outdoors, get vaccinated now, both doses, keep your distance, and avoid gatherings. Stay tuned for more news on boosters in the fall and vaccinations for children under 12 years of age, roughly December through January is a target. Those are the COVID updates I have this morning. And now I'd like to turn it over to Debbie Warfield and Cathi to share more about their 5th annual Candlelight Vigil for Overdose Awareness Night.
Okay, thank you, Shawn, and good morning. And I appreciate being invited to share about our upcoming event, A Night to Remember, A Time to Act. My name is Debbie Warfield, and I'm the mother of Spencer Warfield, who passed from a drug overdose in 2012 at the age of 24. Cathi Lee is also here with me, and we are the co-organizers of this event. Our family, along with the Lee family, who also lost their son Corey, felt we needed to put a face to those loved ones lost to an overdose in Snohomish County. So 5 years ago, we kicked this event off to coincide with International Overdose Awareness Day, recognized on August 31st across the world, in hopes that families would not have to keep silent and would know of resources available to them. This is an opportunity for the community to come together to remember loved ones lost to an overdose, those in recovery, or would simply like to show support or attend our resource fair organized by the Snohomish Health District. Our resource fair will include treatment and service providers, along with community support groups. It starts at 5 p.m. and runs to 6:15, when we will have a live music performance by Kyle Martin. He is a rapper that shares about his recovery journey through his lyrics. At 6:30, our program and candlelighting will start. This will include an array of speakers from the health community and community services. Candles will be provided, and please bring a photo of your loved ones for us to display. We feel this is a real pivotal year for action. We as a community need to understand what is actually happening in our cities, homes, and schools dealing with addiction. With the dual epidemics raging in our county, they have taken their toll on our emergency rooms, resources, medical staff, and community services. We really need to start focusing on prevention, beginning with our youth and providing programs in the school that can address trauma and mental health. The 5th annual A Night to Remember, A Time to Act is focusing on bringing hope and on highlighting the role of prevention and mental health. Also continuing our efforts of combating the stigma against those affected by substance use disorder and mental health by helping families and loved ones of those struggling to feel supported in their need for help and encouraging them to seek out resources. In the last 5 years, we have seen double the number of deaths since our first Candlelight vigil in 2016. Also, there's been a significant increase in deaths linked to synthetic drugs, namely fentanyl. So I hope you can join us on August 31st at the Snohomish County Plaza in Everett. Resource fairs at 5:15, a live music performance at 6:15, and our program and vigil will start at 6:30. It's an outdoor event. Masks are required. Social distancing steps will be in place. It'll also be live streamed on social media if you feel more comfortable with that via Hope Soldiers and Snohomish Overdose Prevention Facebook pages. We'll also be handing out naloxone kits, also known as Narcan, the life-saving opiate overdose reversal drug. So we hope that you can come and join us, and I'll turn it back over to Executive Summers.
Thank you, Debbie. Oh, Debbie, and thank you. I'm getting back here. Maybe, is that better? There we go. All the other mics are closed. We won't get feedback, but thank you, Debbie. Thank you, Cathi. And especially for the reminder that this is can hit any family, and we're all vulnerable, accessible. And I just thank you for your efforts in bringing us together and limiting the stigma. I've had family members that have struggled with addiction also, and in the last year and a half, 2 years through COVID, the problem's grown even worse. So we just really need to stand together, and thank you for your efforts. So I'll get to the questions. The first is looking at the reaction to the FDA vaccine approval. Do you think this will increase the number of people who get the shot? We know there are still a number of people who dismiss the vaccine with the FDA. Okay, Shawn, do you have any thoughts on that?
Sure. I think our thoughts are definitely that we know in our conversations with members of the public that there are people out there who were specifically waiting for the vaccine to be FDA approved before they were willing to get vaccinated. And we're hoping now that approval has happened, that they will move forward and get vaccinated as quickly as possible.
I think we were seeing an uptick because of the uptick in Delta also, but I think this will help. Certainly there are people that are not going and will not get the vaccine no matter what, but everybody that we get vaccinated is helpful. So hope there is an uptick. And for Shawn, do you expect the 5th wave case rate to exceed the previous high in the 3rd wave?
We're definitely, thank you, Executive Summers. We're definitely on track to surpass it if we don't all step up now. As a reminder, the actions that we see today, we really won't see the effects of for 1 to 3 weeks in decreased case rates and hospitalizations. So what we're seeing now is really the results of activities from greater than a week previous. So we really need to make sure that we're taking actions today to really stop how far beyond the previous high we get.
Thank you. So this one looks like it's for me. Well, Shawn, you can address it also. With the Evergreen State Fair set to begin this weekend amidst the Delta surge, is there concern about the ability for people to be safe at the fair? And has there been thought to canceling it? Well, we've been in almost daily discussions about the fair. It's not going to be the same old Evergreen State Fair. The activities are almost entirely now going to be outside events. The vendors that will be there will be in the large, actually, Weichel building, which has roll-up side doors, so it'll be open air to the maximum extent. So we're taking a number of precautions to keep people safe. We will also be asking anybody that has to go indoors, for example, to use the restrooms, to please wear a mask indoors, and we'll be encouraging people to wear masks in general. So in addition to that, we will have measures in place to limit the attendance so we don't get huge crowds of closely packed people. So number of safety features put in place. We believe we can do it safely, and we'll be monitoring it every day. But Shawn, do you want to add on to that?
Definitely. As Executive Summers mentioned, there's ongoing conversation around how the fair happens as safely as possible. I think one of the most important steps, and this is really for the entire public out there, if you're feeling sick, don't come to the fair. That is first and foremost. You know, at every opportunity, make sure that you're doing all of those basic hygiene steps, that you are, as much as possible, maintaining your distance, doing all of those things that we do every day in this environment of COVID to make sure that we're being as safe as possible if and when we have to interact with each other. We all need to take steps to keep each other safe. But we were certainly going to make sure that everything that can be done is being done in partnership to support the county with the fair as it continues to move forward.
Okay, maybe I'll ask you to address this first, but Shawn, do you think that more mandates need to be put in place in order to stop the fifth surge?
I think the largest, the single two greatest things that need to be in place for us to stop the fifth wave is really vaccinations and masking. You know, I think none of us actually want to see more mandates go into effect. We want to be able to do all of those things that we can to keep our economy, our communities moving forward safely. But it requires everyone to do their part to make sure that they're wearing masks and getting vaccinated if they're eligible for us to be able to do that. We can control the spread if we're all working together and doing our part.
Okay, how close are we to seeing hospitals completely full? Do you think that field hospitals need to come back? I can't answer the question about how close they are to being completely full. Maybe Shawn can. Very close is what I'm hearing, but we are always making contingency plans to establish extra capacity, both at the existing hospitals and potentially field hospitals. So those are things that are always in planning and in the works, so that if need be, we can mobilize those things relatively quickly. Shawn, do you have any additional information?
Definitely. Our hospitals are generally staying above 85% occupancy currently. And that's very, very high. They're handling that level of strain. The hospital system has plans in place to be able to manage their capacities, and they're working with other healthcare partners to coordinate things like level loading of patients, not only locally, but across the state. So that's an ongoing effort that the healthcare system, combined with entities like the Northwest Healthcare Response Network, the Disaster Medical Coordination Centers, the Washington Medical Coordination Centers work on a regular basis to manage that patient load, not only locally, but across the region and state.
Okay. Can you elaborate on what the drop in efficacy is being caused by? How much further reduction do you expect, and what does it mean for the community if it continues to decline? Shawn?
Well, it's likely a combination of a few things. As I mentioned earlier, Delta is simply a variant that wasn't around when the vaccine was being developed. But also it's time since the vaccine was received. We are approaching a point where several people have simply received the vaccine quite some time ago. And over time, we know that the overall protection provided by vaccines decreases to some extent. So those are kind of the things that lead to that decreased efficacy over time overall.
Just add, certainly not a doctor, but the information that I've seen and the best advice I can give to people in our community is that this is probably going to be very much like a flu type of vaccine situation where periodic updates or boosters or additional shots are necessary for the reasons Shawn mentioned. Both the virus changes over time and just your natural immunity drops off over time also. So, I think the need for boosters and shots over time could go indefinitely, and just for those very reasons. And that's not unusual. It's nothing strange. It's what we experience with other vaccinations all the time. So expect that in our future. Sometimes federal, state, and local COVID prevention efforts and precaution efforts seem at odds in addition to virus fatigue. How much of what we're seeing is information fatigue? So I think all of those things are at play here. I think people are tired. They want to be done with it in the spring. We all thought we saw the light at the end of the tunnel, and then this fifth wave here locally has hit us. So I know people are tired. And as this has evolved, early on, the things we could recommend to people, masking and social distancing, and the shutdowns of indoor gatherings, those were the really measures that we knew had worked in the past and that we could recommend and were put in place. As this evolves and we got the vaccine, obviously vaccine puts a whole different spin on it, that people can get vaccinated and be pretty safe. And so that's opened up a whole other array of options for us. And, I personally do not want to see businesses shut down again. If it got really bad, a new variant came up, all options are on the table, but we'll try to just make the best recommendations we can to people to get past this. And right now it's get vaccinated, and you be safe, stay away from crowds, and just take common sense measures. But this is an evolving situation. It's been likened to a forest fire, and conditions change and recommendations are going to change, and your response to the conditions has to change all the time. So that's just the way it is. Shawn?
I think you really nailed it, Executive Summers. This really is an ongoing event that's constantly requiring reevaluation of the data that's available and making recommendations and adjusting to those. Information fatigue is very real. Yes, there's certainly fatigue from all angles. But there's also information that's really important that we share as much as possible in the interest of transparency, and we have to remain flexible and nimble at all times.
So the next question's for me. Do you have a timeline for when refugees will be arriving in Snohomish County? And are there any programs in place to help their transition? Well, it's my understanding that the first families have already arrived. And we certainly are teaming up with nonprofits and other organizations to make sure that, first of all, these families are put in appropriate housing. We know this is probably going to need to be for an extended time frame. We know that these families have special dietary needs and eating habits that have to be planned for. There's going language barriers, clothing, needs and special needs, financial needs. So we are teaming up with these nonprofit organizations to make sure that those services are in place. And we're expecting many, many more to come. We're just seeing, the first groups get here. But yes, we are scrambling to put those support services in place, and we will do so. So. And another one for me, 6 summers, I continue to hear from people who question how things can really be as bad as they're being painted right now when all kids are about to return to in-person learning. What specifically would you say to people who ask that question? Well, I think it's a great question. I think we're all concerned about what's going to happen when schools reopen. Again, as I mentioned earlier, in the spring and going into the summer, we thought we saw the light at the end of the tunnel. This 5th wave was not really anticipated. We've just had, and we have ongoing meetings with the school districts to talk about this. They obviously, it takes a lot of planning, a lot of preparation to conduct teaching and set up schools and have them operated. So that momentum has been put in place, but we'll be really working with the school districts and looking at the situations we get into the school year to see how things are going. But I would just caution people that just because they're reopening doesn't mean everything's going to go smoothly, and we're just going to have to support our teachers and school districts as they do that and make the best decisions we can. But the hospitalization rate is real. The case rate is real. The dangers of COVID are real. They have not changed at all. So it's a bit of a perilous situation we're in right now, but we're just trying to support, again, each other. And the health district's been fantastic to work with, and county government trying to work with school districts just to support everybody to get into this. But stay tuned. It's going to be interesting as we open up. Shawn, I know you've been embedded in this issue also. Any thoughts on that?
I think the important thing, as you mentioned, Executive Summers, is we need to be there to support our school districts, making sure that they have access to the resources and the information that they need to make sound decisions. I know that all of those conversations continue as far as planning around different contingencies. Just to kind of hop into the next question, because it's kind of relevant and related. Related to mandates, those conversations continue at all levels with DOH, OSPI, and even the governor's office. If needed, they make more sense for those mandates or MPIs to be put in place from the state level, recognizing that the virus doesn't necessarily respect county boundaries. So, all of those things continue. None of these things are static, as we mentioned earlier, in dealing with the information fatigue. We constantly look at the data and have the relevant conversations and make recommendations and move forward from there as the data becomes relevant for us to make appropriate changes. So certainly tiresome. There's certainly a lot of fatigue there, but the work must continue. We are towards the end of the summer. Kids are going back to school, and very soon we're going to be facing a time when people are going to have less outdoor activities and more indoor activities. And that's when we saw our largest surge last year. So.
One final question on COVID, and then I've got one for Debbie or Cathi. Shawn, is there still a disconnect between cases and hospitalizations and deaths? Any specific demographics on who's getting sick and dying?
I don't have any specific demographics, Executive Summers, although I don't completely understand the disconnect element of the question. If we're talking about the comparison between what we saw last year with hospitalizations and deaths compared to this year, I think a lot of that can be explained that we saw some of our most serious illness and deaths amongst our oldest populations. And this year, our oldest populations were amongst the first and to get vaccinated, and they were largely vaccinated to a much higher degree than the general population. So we see fewer of those deaths occurring this year. But I have no specific demographics that I could share at this time.
Okay. And final question is for Debbie or Cathi. Can you speak more about what you hope to accomplish with the Candlelight Vigil and why it's so important that, given the state of our state and county? Debbie, you're on mute.
Okay, sorry. Yes. What we'd like to accomplish, I guess, for this 5th year is we really would like to see some action within our community. It seems like with COVID, very understandably that that's been our top epidemic, but just want to still bring light to there is another one. There was 93,000 overdoses in the United States, and I believe 230 in the county, our county. So it's just ongoing, and reduce, always trying to reduce the stigma that this can happen to any family. It's not just, necessarily homeless. Usually people become homeless because it's such a tragic and horrible disease that it wears the families out. And there's just not a lot of true treatment that really seems to work. So we're really advocating for more prevention starting at a younger age, looking at trauma and how that affects addiction, and then also the mental health aspect that goes along with it. It seems like mental health plays a huge part in addiction. So that's my thoughts. Cathi, what about yours?
I agree with you, Debbie. I think the mental health part is extremely important right now, especially with COVID. We talk about the information overload and the information fatigue and even COVID fatigue. And I don't even mean physically, I mean mentally. We are, as Debbie said before, that doubled the number of overdoses and the increase in the drug abuse and addiction. We can see in the articles in the paper that even alcohol has increased in the last 18 months since COVID started. We just want to highlight that we're not alone. This is increasing, and we can do things to stop it. We can do things to prevent it from even happening. And that's kind of our focus this year. All along it's been, I think Debbie and I started this mostly because we felt so alone. We felt like we were the only ones struggling with this problem and the shame surrounding this. We're in this together. We're in this together for COVID. We're in this together for overdose awareness and addiction and alcoholism, all those things. So that's what we want to accomplish, is just get the word out and band together to help each other.
So there's a follow-up for you two, and then that'll be our last question. But are you seeing or hearing any more negative impacts because of the changes in drug laws here? Or you've already mentioned COVID and other things, but any thoughts on that you want to share?
Yeah, I think that's probably one of the biggest issues. And I think it kind of goes back to stigma, that the people using drugs maybe are not as worthy as, other other diseases. And that's one of the big things we want to highlight, is that to us and to anyone that has a family member suffering, this disease is just as important as any other disease, and we'd like it treated that way. And as far as about the different regulations, I don't know, I guess I'd have to hear more about that, but I just think the overall feeling is that people that are on the streets or struggling with addiction are just not worthy as other people that have an illness.
Cathi?
I tend to agree with Debbie. I mean, this isn't a single solution problem. Personally, we have a business in Seattle and we see the homeless on a regular basis. I don't know what the answers are. To me, it feels like prevention is the better way. I keep saying it's time to turn off the pipeline. We're doing everything we can for the homeless. We're doing everything we can for housing and solving the symptoms of addiction. But I would really like to see some efforts to stop this epidemic. I mean, it's terrible. It's across the country. It's not just our neighborhood or our communities. It needs to be addressed as a nation, just like COVID has been. I don't know what the answers are. I don't know what the laws, it's very complicated.
Yeah, I'd just like to have one last word on this, is that laws, I think, that are focused on stopping the flow of drugs are appropriate and need to be pursued, but laws that punish those that become addicted, that is the absolute wrong. And this is the stigma we've been talking about, that anybody can become addicted to these very powerful drugs for any number of reasons, really through no fault of their own. You can have pain management issues. There's just a whole number of ways people get into addiction, and the appropriate response is not a law to tell them that that's wrong. And the appropriate response is to help them with their addiction, the underlying conditions that got them into addiction, all the problems come along with it, from losing jobs to homelessness to getting really pushed to the margins of our society. Those are the programs we've been focusing on, and I think that's appropriate. I think the days of just locking people up because they're addicted and need to be over. We need to get on with helping and having the support systems to help people back into productive lives and saving their lives, frankly. And let's focus our enforcement efforts on trying to stem the flow of these drugs into the country, but really turn towards helping those that have become addicted. So,
and helping them at the cure. The traumas, like Debbie said, and the self-medicating and the various reasons for becoming addicted.
I think that's it.
Great. This is Heather in the Joint Information Center. Thank you for joining us. And I want to extend a special thank you to Cathi and Debbie for sharing this morning. We're going to wrap up for today. Please stay tuned for future media availabilities. Have a great day.